Dr. Lalani, welcome. And
Yeah.
why don't you go ahead and tell me who you are and what it is that you do?
Sure. So my name is Dr. Shani Lalani. I am a board certified internal medicine doctor, and my specialty of practice is palliative care and hospice. I work as a locum doctor, which is basically a doctor that goes anywhere where there's a shortage of doctors in United States. And I live in New York City. So New York City is my base. Majority of the time I am in hospitals in New York City area. I lived here for 10 years. This is where I did all my training from med school to residency to fellowship. So recently, this entire year, I was at a pop-up hospital in New York City, dealing with COVID patients, working as an internal medicine hospitalist and a palliative care and hospice doctor here in New York City.
How far do you have to travel sometimes, for these locum gigs?
Yeah, so I actually, you get to choose where you want to go. I've always been very passionate about rural medicine. So I travel a lot to rural areas. So the way it works is that we work with these companies that fly you out to these areas in the United States where there's a severe shortage of doctors. So I've gone everywhere from like Indian reservations to, Ozark, Missouri, to just like upstate New York where certain areas are also rural. But then
Wow.
I go for a couple of days at a time and then I come back to New York City where I work here majority of the time. So it's just my way of giving back. I know once I was done with training a couple of years ago, I knew I wanted to practice in rural areas and just give back. And doing my research, I realized there's so many places in the United States actually where there's a shortage of doctors and I don't have to go international. There's so many places here that have such a severe need. And that are so cut off from a lot of big cities. So instead of traveling internationally, I was like, might as well give back to my own country.
Yeah. And there's always time if you do want to travel internationally. It's like there's never any shortage when it comes to that. So let me ask you, were you in the Ozark when the big Ozark hype was going on? Was the show filming at that time or?
Yeah. No, I know exactly. I mean, I love that show. I don't know.
It's good.
No, but I was actually there before the show happened.
Okay.
Supposedly the show was filmed in like Atlanta or something.
Oh, is that right? I didn't know that.
I think so. But no, I was there before the show happened, and I know that actually put the show on the map. But that area, a lot of rural areas in the U.S. are beautiful.
Yeah.
So much great scenery, and I was like, wow, I would have never been exposed to these areas because I'm a big city type girl, And when you actually go to these areas, you realize like, wow, people live here and are just as nice, and they're so welcoming and they're very appreciative, especially coming in as like a medical provider. They're always like very thankful that someone's coming to their area to help out.
You mentioned palliative hospice care. And so, I don't know a lot of people that specialize in that. But I do know that when people think of palliative care and hospice care, they tend to use those words just interchangeably. They'll just say, oh, they're on palliative, they're on hospice care, and they should be used that way. There's some pretty important differences. So if you could just shed some light on what branch of medicine they fall under, and then also what separates the two of those.
Sure. So whenever I talk about palliative care and hospice, I always tell them that it's basically two specialties under the same umbrella. So palliative care is for anyone with a severe chronic illness. So whether it is cancer, whether it is lung disease, heart disease, dementia, Alzheimer's. And our goal as a palliative care provider is to provide any symptom management. So let's say if they're having cancer-related pain or if they're having difficulty breathing because of their heart failure, we're trained in using medications, whether it is opioids or non-opioids, to manage certain type of symptoms that most of these patients start feeling once they hit a certain stage of the illness. Along with that, my job is to provide support to family and patients, help with advanced care planning, which is, get to know the patient at a very deep level and based on what their goals and wishes are, help them plan for end-of-life care or help them plan for care in general. Now, hospice is for anyone that has a life expectancy of 6 months or less.
Okay, yeah.
So palliative care is for anyone with a chronic illness, and then hospice, on the other hand, is you have to have a life expectancy of 6 months and less to be eligible to be enrolled in hospice. So I know anytime patients, get exposed to palliative care, they get very scared, like, okay, this is the end. But, palliative care is good to be involved early. So if you're diagnosed with heart failure and you're starting to have some symptoms that are difficult to manage, or you need support, with end of life planning or just planning in general, that's when, palliative care comes in. So it's easy to get scared because everyone thinks palliative care is hospice, but hospice has a very specific criteria.
It sounds like it, yeah. Well, that's good to know. And I think that's important for people to understand, because it sounds like palliative care is such a good option for so many people that aren't nearing end of life or don't have the, that kind of prognosis. So it's good to know that that's an option, right? Very viable one. And so talking about those, they kind of say that there's only two certain things in life, right? Taxes and death, right? Both those things we try to avoid, and, we try not to think about and talk about them until they're absolutely necessary to. And so as healthcare professionals, we can definitely grow more comfortable with death and dying and whatnot. But even in healthcare, say, for example, in the emergency department, we're very much focused on keeping people alive and getting them better, right? And there's a lot of, heroic measures being taken, and that's kind of the goal. And although we accept the fact that, when someone's ready to go, they're ready to go, but what is it about end-of-life care, specifically like hospice care, that kind of draws you, people like you, all around the world that get into this specialty, into the practice that most of us try to avoid thinking about in general?
Yeah, I feel like I often get asked a lot, like, what made you go into this? Because it's such a specific field. And one of the things we saw during this pandemic is how quickly someone can deteriorate, how quickly someone can go from being okay to not being okay. Few patients that I started seeing while I was in residency was, for example, I would see an 80-year-old that had metastatic cancer. On top of that, they had, kidney disease. They were on dialysis. On top of that, they would have heart failure. And no one ever spoke to them about what is it that you would want if, your heart stops. Would you want to go naturally, or would you want CPR? If you want to be on a breathing machine, how long? And I realized if these conversations were just started early on, when patients were able to engage in these conversations, if patients were able to say, this is what is a meaningful life to me, and this is not what I would want because it doesn't lead to a meaningful life, and if they were held early on, these conversations, then things would have been different, and there is nothing that really kind of puts life in perspective than kind of being reminded of your mortality, because it kind of truly makes you realize, like, life is short. So when I was in residency, I was always very drawn to, end of life patients, because I felt like it was very easy for me to connect with patients, to spend time with family, to get to know them. And my job as a hospice and palliative care provider is to provide relief of symptoms.
Yeah.
So although some people think like, oh, isn't it depressing? For me, it's more important that they're as comfortable as possible when that time comes. So it was definitely like a lot of things that drew me to this field. But a lot of it is that I feel like my patients teach me so much, just about life and how important it is to focus on being happy and how short life is, and also the importance of proper planning.